What I am about to share with you could completely change the way you think about every blood pressure tablet sitting in your medicine drawer right now. If you have been prescribed Amlodipine, Losartan, or Lisinopril, there is a strong chance that a symptom you have been brushing off as tiredness, old age, stress, or simply a rough night's sleep is actually your body sending you a signal about how that medication is working inside you. And that is what worries me most, because people rarely get hurt because a medicine was prescribed wrong. They get hurt because nobody ever explained what the medicine actually does once it enters their body. And so the early warning signs slip right past them until something serious forces everyone to pay attention. Before we go any further, please subscribe to Senior Health so you never miss the kind of clear, practical guidance that can protect you and the people you love. I am Dr. Anna, and if your doctor has placed you on Amlodipine, Losartan, or Lisinopril to manage your blood pressure, there are 11 things you deserve to fully understand. Not because anyone is hiding information from you, but because appointments are short, explanations get rushed, and most people walk out of the pharmacy with a bottle in their hand and only a fraction of what they truly need to know. By the time this video ends, you will know which effects are completely normal, which ones need urgent attention, which ones seem minor but are actually serious, and most importantly, you will understand that the real goal has never been just a good number on a blood pressure cuff. The real goal is whether you can remain on this medication safely, comfortably, and for the long haul. Let me introduce you to Margaret, because her experience is the reason this conversation matters so much. Margaret was 72, careful, organized, exactly the kind of patient any doctor would describe as a dream to work with. She never missed a dose, never skipped a follow-up visit, and her blood pressure readings looked wonderful on every chart. On paper, everything was going perfectly. But a few months in, she came to my office worried because her shoes had stopped fitting properly. Her ankles puffed up every evening, and by bedtime her legs felt unusually heavy. She assumed she was putting on weight. Her son wondered if it might be her heart. Margaret was genuinely scared. What no one had taken the time to explain to her was that the very medication helping her blood pressure was also producing a specific, well-known side effect, one that can easily be mistaken for something far more frightening. That brings us to number 11, the first thing most appointments simply do not leave time for. These three medications are not three versions of the same pill with different labels stuck on them. Amlodipine belongs to a group called calcium channel blockers. Losartan is part of a group called ARBs. Lisinopril belongs to a group known as ACE inhibitors. All three lower blood pressure, yes, but each one works through a completely different mechanism, and that means each one produces its own unique set of side effects. If you do not understand that one simple fact, you will misread your own body. You might assume every blood pressure medicine behaves the same way, but they absolutely do not. Amlodipine often relaxes blood vessels in a way that leads to swelling in the lower legs. Lisinopril is well known for triggering a dry, lingering cough. Losartan is frequently chosen for people who cannot tolerate that cough. Same destination, different roads, and different signs along the way. Here is why this distinction matters so much. If you develop a cough on Lisinopril and assume every blood pressure pill will do the same thing to you, you might abandon treatment altogether. If you notice swelling on Amlodipine and immediately fear heart failure, you might panic over something manageable. And if you feel completely fine on Losartan and assume there is nothing left to keep an eye on, you could miss a potassium imbalance quietly developing in the background. The first hidden truth is straightforward but powerful. The name on your bottle tells you the drug class, and the drug class tells you the pattern to expect. Once you understand that pattern, your body stops surprising you. And once it stops surprising you, you make calmer, smarter decisions, the kind that can stop a side effect from ever becoming an emergency. Number 10 is exactly what Margaret was living through without realizing it. Amlodipine can cause swelling around the ankles and lower legs, and this is one of the most misunderstood reactions in all of blood pressure treatment. People assume it means they ate too much salt, or that their kidneys are weak and holding on to fluid, or that they are simply becoming less active and gaining weight. But with Amlodipine, the swelling usually happens because the small arteries relax more than the veins do. Blood moves into the legs more freely than it drains back out. Pressure builds up in the tiny vessels, and fluid begins to collect around the ankles and feet. That is why so many people describe it the same way. Fine in the morning, but by evening their socks leave deep marks on their skin. Consider Walter, 76 years old. Every single afternoon, his ankles looked noticeably larger than they had at breakfast. He assumed it was just one more thing that came with getting older. He started propping his legs up at night and noticed the swelling went down by morning, only to creep back later in the day. He never once connected this pattern to the amlodipine he had started taking 6 weeks earlier. What made his situation risky was not the swelling itself, it was his silence about it. He did not want to make a fuss with his doctor, so he kept taking the medication while feeling more and more uncomfortable, and eventually he started skipping doses on days he wanted to go out, simply because he was self-conscious about how his legs looked. That is exactly how a manageable side effect quietly turns into uncontrolled blood pressure. Swelling does not necessarily mean the medication is wrong for you forever, but it absolutely means it is time for a conversation with whoever prescribed it. Number 9 is something people tolerate for far longer than they should. Lisinopril can cause a dry, persistent, irritating cough, and what often goes unexplained is that this cough does not always show up right away. Sometimes it begins within a few days, sometimes a couple of weeks later, and sometimes it does not appear until months after starting the medication, which is exactly why people fail to connect the dots. They blame allergies, dust, acid reflux, a lingering cold, or dry weather. The cough tends to feel scratchy and stubborn, rather than wet or productive. It is not dramatic, just constant, and because it often worsens at night, people assume the problem is in their lungs, when really the cause is sitting quietly in their pill organizer every morning. Ruth discovered this the hard way. At 69, about 4 months after starting lisinopril, she developed a tickle in her throat that simply would not go away. Then came nighttime coughing fits that wrecked her sleep and left her exhausted during the day. She assumed it was age catching up with her, or maybe her old reflux flaring up again. She tried lozenges, switched laundry detergents, even replaced her home's air filter. Nothing worked. When I asked her when the cough had started in relation to her medication, she was stunned. Nobody had ever told her that a lisinopril cough could appear so late. Once that connection was made, everything finally made sense. This matters because countless patients suffer through this cough for months, and a surprising number simply stop taking the medication on their own, without telling anyone, which is precisely the outcome we want to avoid. But there is something far more important hidden within this point, and I need you to hear it clearly. A dry cough on lisinopril is not the same thing as a true allergic emergency. The symptom that should alarm you is swelling of the lips, tongue, face, or throat, especially if it becomes hard to breathe or swallow. That is not a wait-and-see situation, and it is not something to mention at Monday's appointment. That is an emergency, full stop. ACE inhibitors like lisinopril can in rare cases cause a reaction called angioedema, and it can turn dangerous very quickly. ARBs like Losartan can very rarely cause something similar, though the classic concern remains with ACE inhibitors. So remember this distinction. A cough is not a reason to panic, but swelling of the tongue or throat means you act immediately. Number 8 is one of the most dangerous truths in this entire video, and it hides in plain sight on the shelves of your local grocery store. If you take Losartan or lisinopril, potassium becomes something you need to pay attention to. Most people hear that and think, I don't take potassium supplements, so this doesn't apply to me. Unfortunately, that is not how it works, because potassium shows up in far more places than supplement bottles. It is found in salt substitutes, in heart-healthy seasoning blends, in electrolyte powders, in certain meal replacement drinks, and in over-the-counter products that most people never think twice about. Both Losartan and lisinopril can raise potassium levels in the blood, and elevated potassium can become dangerous because it interferes with your heart's electrical rhythm. It does not always announce itself loudly. Early signs can include weakness, muscle cramps, tingling, fatigue, an unusual fluttering in the chest, or sometimes barely any noticeable symptoms at all. Harold's story illustrates this perfectly. At 74, he was working hard to be healthier. He cut back on sodium, started reading nutrition labels, and proudly switched to a salt substitute, believing he was doing exactly what his heart needed. What he did not realize was that many salt substitutes simply replace sodium with potassium. So now he was taking Losartan, which can raise potassium on its own, while also seasoning every meal with extra potassium on top of that. He began to feel weak and slightly off, then started noticing occasional skipped heartbeats. By the time his blood work was finally checked, his potassium level was high enough to require immediate medical attention. The tragic part is that Harold was not careless. He was trying to follow every rule he had been given. Nobody had simply connected the dots for him, and that gap in understanding is exactly where patients get hurt. Number 7 is the truth about kidney numbers, and it confuses people so badly that they sometimes stop a medication right when it may be doing something genuinely protective. Losartan and Lisinopril are not only blood pressure medications. In the right person, they can also help protect the kidneys and heart over the long term. But when you first start one of these drugs, or when the dose is increased, your doctor may order blood work and see a small shift in kidney markers, such as a rise in creatinine or a slight drop in eGFR. To many patients, this looks like proof that the medication is harming their kidneys. Sometimes that concern is valid, but often a small early shift is actually expected because these medications change the pressure dynamics within the kidney's filtering system. That is exactly why follow-up blood tests matter so much and why guessing instead of testing is so risky. Eleanor nearly made this mistake. At 71, she had both high blood pressure and early-stage kidney disease, and her doctor had specifically chosen Lisinopril because of its kidney protective effects. A couple of weeks later, her lab results shifted slightly. She saw the numbers in her online patient portal before anyone had a chance to call and explain them, panicked, and was a single click away from stopping the medication on her own. That same evening when we spoke, I explained that the real question was never simply whether the number moved. The real questions were how much it moved, what the overall trend looked like, and what else was happening in her body at the time. A mild, expected change under proper supervision is a completely different story from a dangerous decline. That is why lab follow-up is not optional. It is part of the treatment itself, because these medications are powerful and effective, but only when they are monitored thoughtfully. Which brings us to number 6, one of the most overlooked dangers for older adults. Dehydration changes everything. If you are taking Losartan or Lisinopril and you come down with vomiting, diarrhea, a stomach bug, poor appetite, or you are sweating heavily in hot weather, the same medication that helped you yesterday can affect you very differently today. Your blood pressure can drop too low, your kidneys can come under stress, and you may feel dizzy, weak, or faint. In some cases, this can progress to acute kidney problems faster than people expect. The medication itself has not changed, but your body's fluid balance has, and now the same dose is acting inside a very different internal environment. This is one of the biggest nobody told me moments in blood pressure care, because people continue taking their usual pills straight through illnesses that dramatically alter their hydration. Bernard learned this the hard way at 78. He came down with a bad stomach virus, could barely keep anything down, yet still took his usual Losartan every morning because he took pride in never missing a dose. That night, he stood up from the sofa, the room spun around him, and he nearly collapsed. In the emergency room, the issue was never that Losartan was a bad medication. The issue was that his body was severely depleted, his blood pressure had dropped too far, and his kidneys were under real strain. What Bernard needed was not blind devotion to his pill bottle, but a clear sick day plan, knowing when illness changes the rules and when it is time to call for guidance instead of pushing through on his own. That kind of advice is not flashy, but it prevents real suffering, and it prevents the dangerous mindset that medication must be taken no matter what your body is going through. Number 5 is the hidden trap sitting quietly in millions of medicine cabinets, and at first glance, it has nothing to do with prescription drugs at all. Ibuprofen, naproxen, those everyday pain relievers people reach for just for my back, or just for my knee, or just to get through the weekend in the garden. If you take Lisinopril or Losartan, especially alongside a diuretic or water pill, regularly using certain anti-inflammatory pain medications can create a genuinely dangerous combination for your kidneys. This particular interaction surprises people because each piece feels harmless on its own. A blood pressure pill, a pain reliever, maybe a water pill. None of it sounds alarming individually. But together, particularly if you become dehydrated, these can reduce blood flow to the kidneys and raise the risk of kidney injury. Most people never mention over-the-counter pain relievers to their doctor, because in their minds, those don't even count as real medication, just something from the drugstore shelf. Norma found this out at 73. She took Lisinopril for her blood pressure, a water pill for swelling in her legs, and used ibuprofen several times a week for arthritis pain in her hands. She felt like she was managing everything beautifully. Then her lab results worsened, her blood pressure became unpredictable, and suddenly everyone was trying to figure out what had changed. It was not a mystery, it was the combination. Once the daily anti-inflammatory was stopped, safer alternatives were discussed, and her monitoring was tightened, things improved. Here is what I want you to take away from this. People often assume medication dangers come only from rare side effects, buried in tiny print on a label. In reality, some of the biggest risks come from everyday combinations that nobody ever sits down to review carefully. If you take Losartan or Lisinopril, over-the-counter pain medication is not a small detail, it is a real safety conversation worth having. Number 4 is the side effect people normalize until it ends in a fall. Dizziness, lightheadedness, that woozy feeling when you stand up too quickly, the weak sensation that can come with the first few doses of a new medication. With all 3 of these drugs, especially when starting treatment or increasing the dose, your body needs time to adjust to a lower blood pressure, and that adjustment period can show up as dizziness, particularly when moving from lying down to standing. People often laugh it off, saying they simply stood up too fast. Sometimes that is true. But in older adults, even a few seconds of dizziness can lead to a fractured wrist, a head injury, or a broken hip. And here is something most people never realize. Dizziness can sometimes mean the medication is working a little too well for your current body, your current hydration level, or your current combination of medications. Stanley, 80 years old, took great pride in his independence. He lived alone, moved carefully through his home, and hated asking anyone for help. 2 days after his Amlodipine dose was increased, he stood up in the bathroom in the middle of the night and felt the room tilt around him. He grabbed the sink just in time, didn't fall, but it shook him badly. When I asked whether anyone had told him to rise slowly, sit on the edge of the bed first, and pay attention to any lingering weakness or near fainting, he simply shook his head. He had been told the medication might lower his blood pressure, but nobody had told him what that could actually feel like in his own body walking through his own dark house at night. That is the difference between handing someone a prescription and actually preparing them for it. Mild dizziness can often improve with time, but fainting should never be ignored, and repeated dizziness should never be quietly endured. Now we move to number 3, and this is where so many thoughtful people unknowingly undermine their own treatment. They take a single blood pressure reading, see a high number, and immediately conclude the medication has stopped working. Or they see one low number and decide the dose must be too strong. That is simply not how blood pressure behaves. It rises and falls constantly, shifting with sleep, pain, stress, conversation, posture, meals, caffeine, and even the anxiety of taking the reading itself. A single number is not a final verdict, it is just a snapshot. What truly matters is the pattern over time, the consistency, what your body is telling you across days and weeks, not what one startled glance at a monitor revealed on a particular morning after poor sleep and a rushed start to the day. Medications like Amlodipine, Losartan, and Lisinopril should be evaluated based on trends, not momentary panic. Patricia, 67, checked her blood pressure every time something worried her. A headache meant a check. A stressful news story meant a check. A high reading meant checking it again 2 minutes later, then again, until she had pages full of numbers and a heart full of anxiety. She was convinced her Lisinopril simply was not working. But once we slowed things down, took readings at the same time each day, and made sure she rested quietly beforehand, a very different picture emerged. Her medication was actually working reasonably well. The chaos had been in her measuring habits, not in the medicine itself. This matters because once people believe their medication has failed, they start making impulsive choices, taking extra doses, skipping doses, or demanding changes based on noise rather than real information. Good treatment combined with poor interpretation leads to poor outcomes every single time. Number 2 is all about timing, and I cannot stress enough how often this creates avoidable risk. These medications work best when taken consistently, the same general time, the same daily routine, the same system every day. If you miss a dose, the answer is almost never to take a double dose later, unless a healthcare provider has given you specific instructions to do so. Most guidance for these medications says to take a missed dose as soon as you remember, unless it is close to your next scheduled dose, in which case you simply skip it and continue your normal routine. You do not take 2 at once. Yet people do this constantly, out of fear that their pressure will spike, only to end up feeling dizzy, weak, or shaken by a drop they essentially caused themselves. Consistency may sound boring, but it is exactly what transforms a prescription into a stable, predictable treatment plan rather than a daily guessing game. Edward, 75, took his medication faithfully, except when he didn't. If he forgot his Lisinopril in the morning, he would take it at lunchtime instead. If he remembered again before dinner, he would convince himself it was safer to take another dose just to be sure. Once, after seeing a high reading at home, he took an extra tablet because he was afraid of having a stroke overnight. That decision left him feeling completely wiped out and unsteady the entire next day. He had not failed because he was careless. He failed because nobody had ever made it clear to him that blood pressure medications are not emergency pills for sudden spikes. They are long-term medications that work through steady, consistent use, not emotional reactions in the moment. If you are unsure what to do after a missed dose, ask. If you are unsure whether you can adjust timing or combine doses, ask. Guessing with these medications might feel like a small decision in the moment, but it can lead to very big problems. And now, number 1, the most important point that often never gets said out loud during a regular appointment. The best blood pressure medication is not the one that produces the most impressive number for a few weeks. It is the one you can remain on safely, consistently, and intelligently because it genuinely fits your body, your symptoms, your other health conditions, your lab results, and your everyday life. That is the truth so many people miss. A medication can look like a complete success on paper while quietly failing in real life because you cannot stand how it makes you feel. You do not understand its warning signs, or you have started avoiding it without telling anyone. Amlodipine might work wonderfully for one person and cause uncomfortable swelling in another. Lisinopril might protect the kidneys and control blood pressure beautifully, yet a persistent dry cough could ruin someone's sleep night after night. Losartan might be a fantastic alternative, but it still requires real attention to potassium, kidney function, and hydration. Let me tell you about Dorothy, because her story brings everything together. At 70, Dorothy had excellent blood pressure readings on lisinopril. Any doctor glancing at her chart would have been pleased, but Dorothy was coughing every single night, her sleep was suffering badly, and she had started dreading taking her medication. She never said anything because she assumed the response would simply be, "You need it, so you'll have to live with it." That assumption is exactly where patients quietly disappear from care. First, they resent the medication, then they start forgetting it on purpose, then they stop taking it entirely, and then their blood pressure climbs back up, while everyone acts surprised. Dorothy did not need a lecture. She needed a medication plan that actually fit her life. Once her cough was identified as likely medication-related, her treatment could be reassessed and adjusted. That is what real care looks like. Not pushing through at any cost. Not silently suffering because a number on a chart looks good. Real care means the person matters just as much as the pressure reading. Here is something I want every single one of you to understand clearly. Side effects are not a personal failing. They are information. Swelling is information. A cough is information. Dizziness is information. Weakness after a bout of dehydration is information. An unusual pounding heartbeat, persistent lightheadedness, growing fatigue, muscle cramps when potassium levels shift. All of these are signals. Your job is not to diagnose yourself. Your job is to notice the pattern and speak up about it. So many people believe being a good patient means never complaining, and that simply is not true. A good patient pays attention. A good patient speaks up early. A good patient does not wait until their throat is swelling, their kidneys are struggling, or their blood pressure is out of control because they quietly stopped their medication weeks ago without telling anyone. Silence is not strength here. Silence is risk, and risk grows in the dark. So let me leave you with the practical framework I want you to remember every time you take amlodipine, losartan, or lisinopril. If you take amlodipine, keep an eye on ankle swelling, flushing, headaches, dizziness, and that heavy feeling in your legs by evening. If you take lisinopril, watch for a persistent dry cough, dizziness, and any swelling of the lips, tongue, or throat. If you take losartan, watch for dizziness, weakness, dehydration during any illness, and signs that potassium may be rising too high, such as muscle weakness, cramping, tingling, or an irregular heartbeat. With losartan and lisinopril especially, regular blood tests matter. With all three, consistency matters. And with every single one of them, any symptom you cannot explain is worth mentioning to your doctor. You do not need to be certain something is wrong to make a phone call. You only need a pattern that concerns you. I also want you to walk away from this without unnecessary fear, because not every side effect is a catastrophe. A mild headache when starting amlodipine often improves. Mild dizziness when blood pressure first drops can settle as your body adjusts. A dry cough on lisinopril can be annoying without being dangerous. But that does not mean every side effect should simply be endured forever. There is a real difference between "this may improve in a few days" and "this is taking away my quality of life," and patients blur that line constantly, either panicking over something manageable or quietly enduring something serious. The answer is never panic, and it is never denial either. The answer is understanding, knowing which class of medication you are taking, how it typically behaves, and which warning signs cross the line from minor annoyance to genuine urgency. So many people live with their blood pressure medication wrapped in a fog of half knowledge. They know the name, they know the dose, they know they're supposed to take, but they have no idea why their ankle swelled, why the cough started, why their lab numbers shifted, why their doctor asked about ibuprofen, why dehydration suddenly mattered so much, or why something as ordinary as a salt substitute could become a problem. That fog breeds fear, and fear breeds poor decisions. The moment you understand what is actually happening inside your body, so much of that fear simply melts away. You stop assuming every symptom is a disaster, and you stop ignoring symptoms that genuinely deserve attention. That balance, not ignorance and not obsession, but real understanding, is where safety truly lives. And once you understand, you become far harder to harm because you stop being a passive bystander with medications this powerful. If this video helped you, please share it with someone you know who is taking blood pressure medication, because there is a very good chance they need this information too. And as always, I'll be back with more guidance from Senior Health to help you understand the health truths that matter most, before they ever have a chance to become emergencies you never saw coming.